When you're new to Medicare, you have a major choice then. Your major choice is you are in your initial election period. You can go to any one you want to go to. Follow me here. You can go on original Medicare and get a Medigap plan, Medicare supplement, which covers everything that's medically necessary covered by Medicare at any provider that accepts original Medicare, which is most in the entire country. That's one way to go. Your doctor decides what's going to be treated and covered right then. Or, and that's the one you paid for your whole life, by the way. That's traditional Medicare, been around for decades. Or you can go Medicare Advantage, and they decide what healthcare is appropriate for you, what doctor you get it from, which ones require prior authorization or not, and which ones they're going to apparently retroactively go back and deny, maybe. Of these two choices, Medicare Advantage plans you can do any year you want to. There is an open enrollment period. It's the annual election period, the technical term. Every year from October 15th through December 7th, you make that choice if you want to, and it kicks in January 1st. And it'll run that entire year from January 1st to December 31st of that next year. Those plans change every single year. What's inside changes, the copays change, the networks can change, the benefits change, the drugs change that are covered. Those plans just change every year, and it's a nonstop game of musical chairs as to what are you going to get next year or which plan are you going to hop to. Meanwhile, that original choice, the road now less traveled, is original Medicare that you paid into your whole working life, a Medicare supplement plan that by law cannot change. They can't take it away from you. It can't change unless one thing happens. You either die or you fail to pay the premium on that insurance plan. They can never, ever, ever take it away from you. The challenge is this. If you don't get it during your initial election period, when you're eligible for any of the plans without any question, without any underwriting, without any health questions whatsoever, you may never then be able to upgrade to that type of plan ever again. Why? Because in most all states, to go on those plans after your past 6 months of your initial election period's over, let's say you start on Medicare January 1st. Well, when July, August, and September arrive, it's too late to go back and get one of those plans unless you go through health questions. One of the reasons I'm so proud of my agency is we are very good at the health questions. We know what's involved to get you approved for those plans, but unfortunately, and what happened again today, which is what drives me to tell you this news, is we had another person call in today. They're on a Medicare Advantage plan, and now they're going through all the steps of paying copay, admission, copay, hitting thousands of dollars out of pocket for a free plan they were told was free, no premiums due whatsoever, and it's killing them, it's crushing them because they're a heavy user of healthcare. And when they turned 65, they said I was healthy as a horse, didn't need anything. Well, do we get easier to take care of or harder to take care of the older that we get? Let's be honest, really? So the problem with this person is now they want to go to original Medicare with a Medicare supplement plan. And once you have a chronic condition, once you're using a wheelchair, cane, or walker, or you've got diabetes with complications, or you've got all these things, you've had major heart issues, you've got things that are so common nowadays, that's when you can't any longer get, that's a double negative, you can no longer obtain a Medicare supplement plan. Yes, we can do the best we can shop the market, we can look at everybody's health questions and the criteria, and we know what those are. We can help with that. But I'm telling you, to have the run of the field to get whichever one you want, you have to make the right decision when you're turning 65.